Marijuana and alcohol affect the body differently, and the risks and effects of their use can vary depending on factors such as the amount consumed, frequency of use, and individual health factors. According to the Centers for Disease Control and Prevention, CDC, alcohol is responsible for an estimated 95,000 deaths each year in the United States alone. This includes deaths from alcohol-related health issues, such as liver disease, as well as from alcohol-related accidents, such as drunk driving accidents. On the other hand, there have been no reported deaths directly caused by marijuana overdose. However, like any substance, marijuana can have potential health risks and negative effects, especially if used excessively or inappropriately. Some of the potential health risks associated with marijuana use include impaired driving, increased risk of mental health problems, and respiratory issues. It's important to note that the risks and effects of using marijuana and alcohol can vary depending on factors such as the amount consumed, frequency of use, and individual health factors. If you have concerns about your use of either substance, it is recommended to speak with a healthcare provider or addiction specialist for guidance and support. There have been many studies published on the effects of marijuana, including its potential health benefits, risks, and side effects. Here are some examples of studies on marijuana. Pain management. A 2018 study published in the Journal of Pain found that cannabis use was associated with significant reductions in chronic pain, and that cannabis may be a viable alternative to opioids for managing chronic pain. Anxiety and depression. A 2020 study published in the Journal of Affective Disorders found that medical cannabis use was associated with reduced symptoms of anxiety and depression in patients with mental health conditions. Cognitive function. A 2018 study published in JAMA Psychiatry found that frequent marijuana use during adolescence was associated with lower IQ scores, poorer educational outcomes, and decreased cognitive abilities in adulthood. Addiction. A 2020 study published in the Journal of Substance Abuse Treatment found that marijuana use disorder, MUD, is associated with significant negative outcomes, including lower quality of life, lower levels of employment, and higher levels of addiction severity. Medical uses. A 2017 report from the National Academies of Sciences, Engineering, and Medicine found substantial evidence that marijuana is effective for treating chronic pain, nausea and vomiting due to chemotherapy, and spasticity due to multiple sclerosis, among other medical conditions. These are just a few examples of the published studies on marijuana. It is important to note that the effects of marijuana can vary depending on the individual, the method of consumption, and other factors. It is recommended to speak with a healthcare provider or addiction specialist for more information on the risks and benefits of marijuana use. Certainly. Here are some additional studies on marijuana. Epilepsy. A 2018 study published in the New England Journal of Medicine found that a purified form of cannabidiol, CBD, a compound found in marijuana, was effective in reducing the frequency of seizures in patients with severe epilepsy. Schizophrenia. A 2018 study published in Psychological Medicine found that high-potency cannabis use was associated with an increased risk of developing schizophrenia, suggesting a possible link between cannabis use and psychosis. Cancer treatment. A 2019 study published in Cancer Medicine found that cannabis use was associated with improved quality of life in cancer patients, including reduced symptoms of pain, nausea, and anxiety. Pregnancy and breastfeeding. A 2020 study published in the journal Pediatrics found that marijuana use during pregnancy and breastfeeding may have negative effects on fetal and child development, including lower birth weight and cognitive impairments. Cardiovascular health. A 2021 study published in the Journal of the American Heart Association found that marijuana use was associated with an increased risk of cardiovascular disease, including stroke and heart failure. It is important to note that while marijuana may have potential health benefits, it also carries risks and side effects, and its effects can vary depending on the individual, the method of consumption, and other factors. It is recommended to speak with a healthcare provider or addiction specialist for more information on the risks and benefits of marijuana use.